I'm Berks County Commissioner Christian Leinbach, and I want to welcome you to our Commissioners Board meeting for March the 18th. We are broadcasting live via Microsoft Teams live event and broadcasting to BCTV, Facebook, and YouTube Live. At this time, I'd like to recognize my Executive Assistant, Mary Buer.
Thank you. Public comment will be accepted through the Q&A function. Please include your first name, last name, and municipality. Any comments without name and municipality will not be considered. Excuse me. Each citizen can submit one comment. Comment length is dictated by limitations of the platform being used. Teams, someone else is going to have to finish reading. I apologize.
Comment length is dictated by the limitation of the platform being used, Teams Q&A, Facebook, and YouTube. The meeting comment period is limited to 30 minutes in total. Please be concise. Comments will be read during the meeting and should not be considered to be interactive dialogue with the commissioners. Any commissioner response to the public comment will be done at the discretion of the commissioners. As always, we will begin our program with a moment of silence, followed by a pledge to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. As we begin each week, we will start with the Berks County COVID-19 data report. It's presented by Brian Gottschall, Director of the Berks County Department of Emergency Services, and our lead on the Berks County COVID-19 leadership team. Welcome, Brian.
Good morning, Commissioners. Thank you. I'll give a moment for IT to get the slide up. All right. Yes, as you said, our report for this week, March the 18th. As always, a look at our early warning dashboard from the state. This is last Friday's publication, the most recent publication of this data. We see, again, good downward trending indicators, not quite in the downward slope that we had been seeing in weeks prior, which continues to cause us some concern. We would like to see that downward slope continue in a steep way and get all the way down to zero for the most of these indicators. We are starting to see that slope flatten out. We hope that that's just a temporary blip in the data and that we'll see that start to steepen up again. We can kind of see that a little bit more over here as we look at the cases and testing data. We see that we are down from a low that was probably in about the end of February, beginning of March, as far as our smooth case counts, and we have seen an upward trend in this over the last 14-day period. So we hope that, I mentioned a couple weeks ago, I think that Dr. Keller from the local clinic observed that perhaps the reason we saw such a sharp decline was due to the fact that we had severe weather and people weren't getting out and mingling so much, and that once the weather got nice again, perhaps folks would begin moving around and we would see our cases start to come up. It appears as though she may have been somewhat prescient in determining that. And we hope that folks, as the weather does get nicer and they start to move around more, will be attentive to the mitigation measures that we've talked about for the last year and make sure that they're using those to the extent practical so that we can keep this very flat and or possibly even hopefully get to a downward trend again. Our positivity kind of reflects our case count and that we're not going up sharply, but we are going up from where our low was and in a somewhat shallow way. These generally go hand in hand with perhaps the positivity as a leading indicator to the case count problem. On the very good news front, our death slope continues to remain flat. We do have deaths here and there almost every day, some days skipped in between, and obviously each one of those is an individual tragedy for the person, their friends and family. And we don't want to forget that as we talk about these in a very analytical way. But the good news is that for our community as a whole, we're seeing this curve flatten out very much and get back to the daily counts that we were seeing throughout the middle into late summer. Our hospitals continue to be in a good place. A couple weeks ago, we did have a kind of 1 week upward blip that appeared to be an anomaly, but we are in general seeing the cases at our local hospitals trending down, and the hospitals are managing those cases well. Our weekly snapshot that we look at where we compare Berks to other counties, we did see a small upward adjustment in our number of cases per capita, in our number of tests per capita. And that's really great news, because if we see the cases per capita going down, along with the test per capita going down, that kind of might make us a little bit concerned that there's a lot of people out there that are asymptomatic and aren't getting tested and we're missing them. But when we see our test count go up in comparison to other counties, while at the same time our cases are moving in the other direction with other counties, that's kind of good news for us overall. So again, we want to see case count, keep saying it the wrong way. We want to see test counts increasing while case counts are decreasing. That's really the direction that we're looking for in order to make sure that a downward trend in cases is really reflecting what's going on in the community. And again, onward, continuing good news that our death count per capita is continuing to trend downward. Getting on to the topic that everybody's most interested in these days, vaccines. This week, we are 12th in the Commonwealth in the number of first dose administrations and 14th in the number of fully vaccinated or second dose administrations. A week ago, we were 12th and 13th. So a small downward tick in the number of fully vaccinated, but that's not unexpected, because a number of weeks ago, as we were going through the decreased allocation of vaccine from the state due to them trying to clean up the second dose problem, we saw our first doses go down dramatically. So it makes sense that 3 to 4 weeks later, we would be lagging in the second doses that are administered behind those first doses. The good news is, and I guess we really have to stop talking about this in the term of first dose and second dose, because now that Johnson & Johnson is getting out there in our community, primarily among healthcare and school folks these days, we can't think about fully administered equaling second doses anymore, because fully covered may mean people that had only a single dose of Johnson & Johnson. So I guess I have to recalibrate my verbiage and start talking about this a little bit differently in future weeks, instead of first and second doses. This is a slide that we showed for the first time last week, because I thought it gave a pretty good representation of where Berks County is with respect to other counties in the Commonwealth. I'll kind of recap it again for folks that missed last week. Again, we're looking for dark colors. We would very much like if Berks County were the darkest color on the map in both categories. But the gray one is folks that have partial administrations or just a first dose of Moderna or Pfizer. And the pink map is full administrations, or people that have had the second dose of those or the first dose of Johnson & Johnson. The darker, the better. That means more people per capita. And because these graphics are scaled on a per capita basis, it kind of controls for the largeness or smallness of a county and makes everybody able to be compared equally. There really has not been significant change anywhere throughout the Commonwealth from week to week, so the map looks very much like it did previously. We always show the opportunities in Berks County. There are still the same approximately 34 locations within Berks possible. I'm probably going to modify this slide moving forward because we know that a number of those providers have not gotten vaccine in weeks. And in fact, I'm going to share some information at the end here that we learned from DOH last night that tells us that many of these providers are not going to get vaccine moving forward. So we'll come back to that. But in the last week, there were about 11,700 doses received in Berks County. Not nearly enough, but on the good news front, better than we've seen in any other week to date. Those 11,700 doses were among 18 total providers at two very opposite ends of the spectrum, and I'll talk about that in a moment. This is our eye chart that we show every week. Every time a new provider gets added in the county, the text has to get a little smaller to show it on one screen, and I apologize for that. But these are all of the providers in the county who have gotten vaccines since day one, the total number of doses they've received in Pfizer and Moderna, and then summed up. This takes that same information and resorts it weekly, showing how much vaccine we've gotten week over week. And the data that we talked about in the GIS slide there about the number of doses received, the number of providers, would be for week 13, the one level up from the bottom of the chart that's on the screen. And that reflects what is the last full week of data. We do have partial data for week 14, and this is some good news that I want to illustrate. So in week 13, which was our largest allocation to date, we received almost 11,700 doses. In week 14, we're already at 11,850 doses, and that has not included any data from the state about the commercial pharmacy partnership program, which is the small pharmacies and the chain pharmacies, not necessarily small, that receive reasonably small allocations week over week. It also does not include any allocation for the CVS pharmacies who are receiving Pfizer vaccine under the Pfizer Pharmacy Partnership Program. So we would hope that once the data is finalized, we would actually see that 11,850 number grow by anywhere from 2,000 to 2,600 doses based on the trends that we've seen week over week. And that, of course, would put us significantly above any prior allocation if those pharmacy allocations do come through this week. Again, we've been showing the information about allocation to counties. Just to reiterate what this slide demonstrates, the counties in blue are the counties that have county level health departments. Again, attempting to demonstrate that this is a problem across the board in the populated counties throughout the Commonwealth, not just counties that don't have a health department. We see that Berks cumulatively ranked across all 14 weeks is 52nd in the state as far as doses allocated to the county per capita. In line with York, Lancaster, Westmoreland, and even to some extent Montgomery, Bucks, and Chester. This is a issue of concern for all of the most populated counties in the state who have been making a case to DOH that the allocations that have been coming to us have not been adequate given the size of the county's population. And we've further drawn this out in an effort to demonstrate to DOH where this problem has come from. This chart is a new chart that we haven't shown previously in this meeting, but what this does is it breaks down, and instead of looking at it, it looks at it cumulatively all the way in the right-hand column, but it also looks at each week of allocation for where counties have been in the ranking per capita. And if we focus in on Berks, which is about the 6th or 7th row down here, we can see that we've vacillated from the 40s. Our best position prior to this week was 26th during week 2, but in general, we've been in the 40s or even 50s in ranking per capita until this most current week. With the allocation that was done in week 14, if we only look at week 14 as a snapshot, we see that we are 16th in the state as far as doses per capita. The good news about this is that the state has indicated to us that the allocation that was done in week 14 is going to reflect how the allocations are going to be done moving forward throughout the Commonwealth. And while it's great news that we would end up then around 16th per capita, as opposed to 56th or 45th or wherever we were, it still isn't good enough. And I know that I'm saying this more for the benefit of the public than the commissioners, because it is the commissioners themselves who have committed to continuous engagement with DOH to ensure that we're seeing more allocation coming into Berks County. And our legislative delegation is also on board with this and lobbying to DOH to try to correct these problems that existed in prior weeks. I believe that through ongoing collaboration with DOH, we're going to be able to change that number even more and get Berks in line with where they really ought to be, which is more, around 8th or so in ranking in the Commonwealth. And we also see that our partners in the neighboring larger counties are also making improvements, not nearly to the extent that Berks has in going from 53rd to 16. But we see Montgomery going from 42nd to 29th and Delaware going from 38th to 15th. That's a pretty significant jump there, even given their population. So all of the more populated counties are really doing hard work to try to lobby with the state to fix these problems that have come out over the last number of weeks and ensure that the vaccine that's coming into our area is appropriate given the population of our area. So that takes us to the dialogue that we've been having with the Department of Health and some information that we'd like to share with the public. We have found that DOH has decided that they're going to focus vaccine allocation on 8 key providers, and those providers are listed here on the screen. The DOH believes that by focusing on these 8 key providers who have demonstrated a capability to move vaccine out the door, they're going to be able to better serve the population in Berks County. And I believe that it's fair to say that we in Berks County government generally agree with the assertion of focusing on these folks. The other thing that this does for us as a county now is it gives us a captive audience. With 34 providers who might get anywhere from 100 doses to 1,500 doses in any given week, we really were scrambling to try to figure out where to focus our attention and our effort to help logistically where we could to have these providers be successful. Now that the state has culled this list down to 8 and said that this 8 is going to be consistent, we can very much more focus our attention on these 8 and how we can help them. The state has also said that there's going to be approximately 12,000 doses a week coming into Berks County moving forward. Again, this gives us not a great, we want that number to be bigger, but whatever the number is going to be, at least it helps us to understand how much we're going to get week over week and be able to plan with these providers what the best way is to get that out to the public. The one caveat that I'd make clear for the public is that the status of the Retail Pharmacy Partnership Program remains unclear. And this is the Rite Aids, the Weisses, the Giants, what they categorize as the Topco pharmacies. We are still unclear whether, in addition to these 8, the state is going to allocate vaccine to those pharmacies, and if so, in what volume. So I think we'll get a little bit more clarity about that as the weeks move on and understand whether those partners also will be at the table trying to fill in the gaps. We recognize geographically that some of the farther out areas of the county, particularly the far north, the far west, and the far south, are not represented in these 8 key providers. So people may have to travel a little bit to get to one of these larger providers, and we hope that some of that gap will be filled in by the state continuing to provide vaccine to those smaller pharmacy operations that do have geographical representation in the farther out areas of the county. So I'll pause there, Commissioner. That's our report for this week. I know we're going to defer to Commissioner Barnhart to talk about the Co-County Wellness Report and also the county's efforts with respect to our partnership with BCHC, but perhaps there may be some questions with respect to the report before we move on.
So I just want to acknowledge that late yesterday, Brian led a discussion, virtual discussion, with the governor's office and the Pennsylvania Department of Health. That is where we got the information on these 8 targeted entities for Berks County and quite a bit of additional information. We talked to them about the mass vaccination clinic that the county is standing up and how that will function. You'll hear more about that in a minute. Senator Schwank was on that call with us and is working to advocate as well. We are hopeful that the improvement we're seeing this week continues going forward. I can tell you our colleagues here in southeastern Pennsylvania, a number of them continue to be very, very concerned. And frankly, we're happy to be at 16th for at least at this point this week. I would really be very unhappy if I was Montgomery and Chester County because they are actually significantly worse now than we are, and they're significantly larger counties than we are, which I will also state, which we've stated many times, which have a county Department of Health. So that's not making a difference in this challenge. But thank you for the detailed update, and we'll be hopeful that we see Berks County continue to improve its availability when it comes to vaccine. Any other comments or questions? Okay, we'll move to Commissioner Kevin Barnhart, and he's giving two reports, Cook County Wellness on the contact tracing, and then an update on the mass vaccination clinic being set up by the County of Berks.
Thank you, Commissioner Leinbach, and welcome everyone who has joined us this morning. I will bookend my comments as I've done in previous weeks to remind people to sign up for the newsletter and do your part, Berks.com. Make sure you sign up for that newsletter because more and accurate information will be forthcoming on that email newsletter regarding the center we are standing up in Muhlenberg Township. So first and foremost, Cook County Wellness report for the week. And again, trending slightly higher than last week, 502 new cases with a total of 365 contacts. That's 72.7% success rate. And they certainly reach back and try to get all 502 people. Again, 40 lines, predominantly school districts and sporting events, sporting activities. Total cumulative since middle of June of last year, contact tracing in Berks County has been 9,902. Moving to the vaccine center, the task force meets weekly, sometimes twice a week. We met twice this week. And we've developed, obviously, a punch list of items to do. We do receive requests for people to volunteer for just greeting people or acknowledging people, helping at sign-in, and people that are also volunteering to vaccinate. So I want to thank people for doing that and keep those volunteer efforts coming. We have Stephanie Weaver, our public information officer, Emily Orshak, also from our library system, working on marketing and promotion. And at this time, we'd like to unveil the what the logo will look like going forward as we're promoting the efforts in our vaccine center, which will be located in Muhlenberg Township. We'll be utilizing this in addition with billboards, handouts. BARDA will be advertising this heavily. Area Agency on Aging has some aging funds we can use to promote the elderly to get vaccinated on billboards throughout Berks County. So as you see on the screen, Berks Cares Vaccine Center. It's a public health collaborative with the Berks Community Health Center. And our partners are down below: Community Health Center, as I mentioned, Cook County Wellness Services, which will be our call-in and registration portal. BARDA will be providing service to and from the vaccine center. Public libraries, public outreach, and also assisting people who don't necessarily have internet access. And of course, the County of Berks, along with our Department of Emergency Services. Brian has been hugely instrumental in getting this site up and running for us. It will be located at the North Reading Plaza, right next door to the Walmart on the 5th Street Highway. It will be staffed by Berks Community Health Center staff doing the actual vaccinations, and the fit out will be done by Irish Creek. Our target date is through the Community Health Center is April 1st. This is all going to be based on the influx or increase of vaccines coming into Berks County. As Brian and Commissioner Leinbach mentioned earlier, we're put our foot down and really put the pedal to the metal with the state, recognizing we need more and more vaccines coming into Berks County. Quite frankly, we should be 8th instead of 16th to 52nd. We also are moving forward with our software platform, which will be the platform used by Cook County Wellness to schedule people for their appointments at our center in Muhlenberg Township. It will be done through ServiceNow. We had a presentation for about an hour and a half on Monday. Chester County has ramped up using ServiceNow, and they're very pleased with their service. Initially, the plans will be Monday through Friday at the call center, 9 to 5. There could be a need for extensive hours, but again, this is all predicated on volume of vaccines. There will be an 888 number to call. That will be rolled out shortly. And we want to emphasize, as we always have in the past, Do not call our partners to try to schedule an appointment. Do not call the libraries. Do not call Area Agency on Aging. Do not call Brian. Do not call the health center or other entities. This is going to be focused through the 888 number or the registration item. There will be certainly bilingual, and no one will get a busy signal. The overflow calls will be transferred to other extensions. So again, I mentioned that the site will be at the North Reading Plaza in Muhlenberg, adjacent to the Walmart. It's 18,000 square feet. The maximum capacity of the building is about 180 people. So it's more than adequate for our needs. And I want to mention again, BARDA will be providing routes number 1 and number 3, which are the Temple and the Fifth Street Highway buses, free to people coming to and from the vaccine center, as well as rides on shared ride for people who cannot access fixed route transportation. So far, BARDA has provided 75 rides to vaccine centers throughout the county to people who can't get there on their own. Libraries, Area Agency on Aging has been really instrumental in working through the people who do not have access to transportation or the internet. And our library partners are working on materials, handouts, a mobile job lab, and things for people to occupy a little bit of their time while they're waiting either to get their vaccine or waiting their required 15 minutes to stand by until the vaccine is cleared so that they can move on. So a lot of things in the works. Again, this is a community partnership. This is not solely the county. It's a community partnership. And you will notice from our agenda today that items E, F, and G will solidify the relationship we have with North Reading Plaza, with the Community Health Center, as well as the fit out project, which will be done by Irish Creek. So again, we're trying to do everything we can to keep this about the community. We are really pleased that we do have these other 8 partners in the community that will be receiving larger quantities of doses, and we certainly hope to be part of that going forward as we move beyond 1A into 1B, 1C, and then into 2s. Last but not least, there's always a question about this, so I will bring it up in this report. The number of COVID positive cases as of today, tracking at the Berks County Jail, inmate total 35 and staff 13. We had 1 inmate who needed hospitalization for a day early part of this week. So again, I just want to finish my comments with, please register on the newsletter website, doyourpartberks.com. We mentioned this the other week and like 500 people wanted to sign up. So we want to try to really keep this focused on this vaccine center. So the people that either call or register through Cook County Wellness generally could and should be that group that are underserved and have not been successful on getting on other lists throughout our community. So looking forward to more vaccines and looking forward to rolling out this vaccine center with our community partners. And it's really been a pleasure helping pull this together. Thank you.
Thank you very much, Commissioner Barnhart. Sticking with the same topic, I want to recognize Pam Shupp-Manette. Pam is the Deputy Chief Administrative Officer for the County of Berks and also our Director for Berks County Economic Development. She's going to present an update on the Recovery Act dollars that are coming to Berks County specifically, and then also delineate direct dollars that are coming to the various municipalities. I don't know that she's going to share every single municipality, but she can tell you where you can access that information. Pam.
Thank you, Commissioner Leinbach. Through the American Rescue Plan, and we are certainly receiving information daily, fast and furious, but we were, through the National Association of Counties, able to get some really up-to-date information to let us know that the estimate for Berks County is about $81.6 million that would come directly to Berks County. We also understand that it will come to us in 2 tranches of money. One as soon as, could be as soon as June of this year, and then the second tranche of money, the other 50% coming next year. And we will have, unlike the CARES funds, which had a very tight timeline, we will have through December 31st of 2024 to spend these dollars. We are looking to put together an American Rescue planning team so that we can really thoughtfully determine how these monies are best spent. And one of the things that Commissioner Barnhart touted for several years was the importance of participating in the census, and much of these dollars, other than for urban counties, is dependent on some of those 2019 census numbers. So this is certainly one of the things that points to why it is so important to get the best and most correct census count that you can. So it also looks like the City of Reading is estimated to receive about a little over $63 million. We've got 6 municipalities that will receive over $1 million. And the way that the estimates stand right now is that every municipality in Berks County will receive something. And again, much of this is based off of census data, and then the county estimates are based off of the fiscal year 2020 HUD data. We will be looking to coordinate to the best of our ability with our municipalities and with organizations throughout Berks County, again, to make sure that we deploy these funds in the best way possible to benefit our residents. And we will certainly look forward to input on that. So these funds will come directly to Berks County from the Treasury, and then Berks County will be responsible for reporting back to the Treasury for these funds. And say that 3 times fast.
Yeah, and the same thing applies for the municipalities. These dollars, as I understand, are going to go directly to the municipalities, and with a similar process, 50-50. And my understanding is it could be June, but I've been told 30 to 60 days from the signing, and it's more likely April, May, and then 12 months later for the second half of that. And there's a lot, it's a lot more flexible in the way the dollars can be spent. However, we have to always remind ourselves, even though these are federal dollars, these are taxpayer dollars. And we have a responsibility to be completely transparent with how these dollars are going to be spent, not just meeting the standards and responding to the federal government, but responding to the public. And that's why we want to utilize the same process that we used on the CARES money, bringing in public, if we will, committees from the local community to look at the different areas, to oversee the application process. And I want to emphasize that commissioners are not making the decision of who gets money, who doesn't get money. We vote on the recommendations that come from the various subcommittees. But I would encourage people, if you contact us looking for support or help for your project, we're going to direct you back to the appropriate process, because we don't want anybody to get special treatment. We want everyone to have an equal opportunity to access these dollars and take the input of the various subcommittees that will make recommendations to the board. So just to thank you very much, Pam, for your leadership on this. And both Commissioner Barnhart and Commissioner Rivera, we're in this together. We believe very strongly that we have an obligation to treat these dollars for what they are. They're taxpayer dollars, and we need to respect that, and we will. Thank you very much. Any comments or questions from my colleagues?
No, you and Pam summed it up very well. Thank you.
Thank you very much. We will move on with the agenda. Are there any additions or corrections for the March 11th Commissioner meeting minutes and the March 16th operation meeting minutes? Hearing none, the minutes will stand approved as presented. Mary, is there any public comment on specific agenda items?
There is one comment on today's agenda from Wayne Lesher, Burnville. Good morning, Commissioners. After reading today's agenda, it looks like the county is doing a first-rate job of having clinics available for residents to get the COVID-19 vaccine. This is all taking place without the need of a county health department.
Thank you very much, Mary. And moving into the agenda, item 1, authorizing under that budget department, adopt a resolution authorizing 2020 appropriations in the negative amount of $43,004, 2021 budget transfers in the amount of $20,152, and 2021 appropriations in the amount of $1,269,647 per listing dated March the 15th. We have 2 items under Human Resources. Item 1, authorize the promotion of Sylvia Gutierrez from Voter Registrar 2 to Support Coordinator in Election Services. Item 2, authorize the salary adjustment for Donna Black, Chief Registrar, Election Services. We have a number of items listed under the Commissioners. Adopt a resolution amending the signal booster technical requirements associated with the Berks County Public Safety Radio System, approved through the enactment of a Berks County ordinance to require a Class A channelized signal booster in place of Class B wideband, reducing the risk of interference to third parties unless the applicant can justify the need for a Class B device. The amendment to the signal booster technical requirements is allowed under Section 4 of the ordinance. Item B, adopt a resolution authorizing the chair to execute the memorandum of understanding between Montgomery County and its Department of Public Safety and Berks County and its Department of Emergency Services, permitting each county to program the other county's radio system into the radios of certain emergency responders to improve coordination and support over county borders. Item C, adopt a resolution authorizing the chair to execute the sub-recipient agreement with Berks County Redevelopment Authority for the administration of the state's Emergency Rental Assistance Program. Said award is in the amount of $15,150,690.51 and runs through December 31st of 2021. Item D, adopt a resolution authorizing tax forgiveness of 2020 county real estate taxes, including penalties and interest, in the amount of $969.45 for a parcel in Lower Alces Township, Berks County. The property is owned by Dayspring Homes, a group home for individuals with developmental disabilities. Item E, adopt a resolution ratifying, confirming, and approving execution by the chair of the license agreement between North Reading Investors LP, New York, New York, the County of Berks, and Berks Community Health Center, Reading, PA, for the use of premises located at North Reading Plaza, Muhlenberg Township, for use and operation as a vaccination clinic. Item F, adopt a resolution authorizing the chair to execute the agreement between the County of Berks and Berks Community Health Center to provide professional medical personnel to staff a COVID-19 vaccination clinic in Muhlenberg Township and administer vaccinations to Berks County residents. Item G, adopt a resolution authorizing Brian Gottschall, Director of Berks County Department of Emergency Management, to execute any and all change orders required in conjunction with the vaccine clinic fit-out project up to and not to exceed the amount of $10,000. Item H, adopt a resolution authorizing the chief clerk to advertise enactment of a proposed county ordinance authorizing the Berks County Board of Commissioners to enter into an intergovernmental agreement to establish the Berks County Uniform Construction Code Board of Appeals in cooperation with participating municipalities with Berks County. Item I, adopt a resolution authorizing the chair to execute the deed of easement by and between the County of Berks grantor and Berks County Investments LLC grantee for a certain tract of land consisting of 252.87 square feet located between the Berks County Courthouse and the Berks County Trust Building in connection with the renovation of the Berks Trust Building. Item J, adopt a resolution authorizing the chair to execute a letter of support to the Deputy Secretary for Workforce Development of Pennsylvania, approving submission of the program year 2021 through 2024 Workforce Innovation and Opportunity Act regional and local plans for the Southeast Region counties, presented at the March 16th Berks County Operations meeting. Item 2, a motion authorizing execution of contract agreements and amendments as set forth on the attached listing dated March the 16th of 2021. There are a total of 9 contracts, 1 with CareerLink, 3 with Children and Youth Services, 1 with the Commissioners, 2 with Facilities and Operations, 1 with Information Systems, and 1 with Juvenile Probation. And then item 3, a motion to ratify and confirm payments as set forth on the Controller's Office voucher listing dated March the 16th of 2021, and the payment of electronic transfers and employee payroll.
Motion to approve the agenda as presented.
Second.
The motion has been made and seconded. Is there any discussion? Hearing none, all those in favor signify by saying aye. Aye. Opposed? The motion is carried. At this point, we will move to the report of our Berks County Treasurer, Dennis Adams. Dennis? Is Dennis Adams on? He is not on. I have his report because I thought that might be a possibility. The general account closing, the general account balance is $179,912,252.84. There's a total balance to clear of $5,409,135.49, leaving a balance of $172,077,099.35. And with that, we'll move to our County Controller, Sandy Graffius.
Good morning. Our total accounts payable is $6,940,859.77. We had a payroll this week, and the payroll was $4,420,231.63 for a grand total of $11,361,094.40.
Thank you very much. We'll move now to our Chief Administrative Officer, Ron Seaman.
Thank you, Commissioner Leinbach. All noteworthy items have already been addressed by others, so I'll turn it back to you.
Thank you very much. We'll move now to Commissioner's comments, and we'll begin with Commissioner Kevin Barnhart.
That Ron Seaman, such a modest guy. I just want to commend, yesterday we had our ballot position drawing for the primary, which took well over 2.5 hours to go through about 295 names in contested races throughout the county, which I'm very pleased to see so many people stepping forward to serve in local government. But I want to take a public moment to thank our IT department. I mean, they were planning this thing for weeks and weeks, along with our election services department, headed by Ron Rakowski. They did a phenomenal job of coordinating the people that were in person in the auditorium, the people that came in on Microsoft Teams. It wasn't without a few minor glitches created more by me than anyone else, but it was really, really well done. All safely, social distancing protocols were in place. I want to thank Ron Seaman for his diligence in flipping the chips over, and the board especially. Christian, you hung in there through the whole thing, as well as Michael Rivera. We got it done. So thanks to everyone who put that together yesterday. There was a lot of anxious moments leading up to it, but it went tremendously well, and that's a testament to our staff here in the County of Berks. Thank you.
Thank you very much. And we'll move now to Commissioner Michael Rivera.
Yes, thank you, Commissioner Leinbach. Just a few items I want to touch on. First of all, I want to congratulate Sylvia Gutierrez, who is the new HAVA coordinator. Welcome to that position. Sylvia has been in election services for a few years now, and she's looking to grow there. So congratulations. Look forward to working with you as much as I can on that, Sylvia. And another item, for your information, there's what's called an R3 prep for young adult program, R3 Prep for Young Adults program through Berks Connections and Pretrial Services. This is a program that serves youth from 18 to 24 years old. And the Workforce Development Board obtained a grant from the Pennsylvania Department of Labor and Industry and partnered with Berks Connections Pretrial Services to provide GED preparation, mentorship, case management, and an introduction to cognitive programming and preparation for the R3 program. That's a program that helps young men and women in the trades, and to help them get in the trades and get an apprenticeship and get into the construction areas, as well as other jobs. So if you would like more information on this, you can reach out to Berks Connections Pretrial Services. You can contact Jessica Nunez. Her number is 484-260-3860. Again, that's 484-260-3860, extension 3023. So if you do know of anyone between the ages of 18 and 24 that may benefit from this program, please call them and get more information. Also wanted to update the CHIRP grant program, which is the grant program for business in the hospitality industry, opened up on Monday. As of this morning, there were 54 applications representing up to $2 million. So there has been a good start to that. It is open for 3 weeks, starting this past Monday. Again, if you know anyone in the hospitality industry, please let them know about this program. You can get more information at rebuildberks.com, or you can go to the county's website or Do Your Part Berks and get a link there as well. Again, rebuildberks.com for more information on the hospitality industry grant. The Emergency Rental Assistance Program has started as well, bceh.org for more information on that. And one last item, on Tuesday we had our operations meeting, and Ashley Showers and David Hunter from the Planning Commission presented the Berks County Planning Commission annual report for 2019 and 2020. Please go to our website, to the Planning Commission's page, and look at that annual report. There's a lot of good information in there. The good thing about it, it's an easy read. There's graphics, there's charts, pictures, so you won't find pages and pages and pages of just words in there. It's like I said, it's a very easy read, very interesting, important to know what's going on in the county, what the county's future plans are as well. So again, it's the Berks County Planning Commission annual report for 2019 and 2020. Please take a look at that if you have some time. Also, the Workforce Development Board, led by Dan Fogarty, presented the 4-year Workforce Development Plan for post-pandemic recovery. That still needs to go through their board and some approvals, but that was presented at the operations meeting on Tuesday as well. And once that is made public, we will share it. Also, again, Very important information. It shows where Berks County is in reference to unemployment compared to other counties in the state, as well as compared to the nation as well. And the reality is we are in a good position recovering from the pandemics in reference to workforce and people being employed. So more information on that as it comes out. Thank you very much.
Thank you very much, Commissioner Rivera and Commissioner Barnhart. Just a couple of items that I want to touch on. I'm going to begin by sharing my screen. I already saw that there's a comment on the Berks County pension, and we actually had our monthly meeting this morning at 9:30, a public meeting. And this is the current total value of the Berks County pension, $545 million, almost $546 million. As of the end of last year, on an accounting basis, it was overfunded at 102%. Right now, we are probably right around 100% or 100% plus. The county has been very careful and conservative in managing the employee retirement fund. Ever since I've been here, I'm proud of the model that we moved to in late 2008. Prior to that time, all the counties in Pennsylvania their pension board acted as active managers. In other words, pension boards interviewed various fund managers, hired and fired fund managers. And in 2008, we brought a company in called SEI out of Oaks, Pennsylvania. And the model, they manage the managers, and we work with them to manage the policy, the pension plan policy, focusing on the returns. And it has worked very, very well for the county. And proof that it's a good model, the various competitors that were around in 2008 that didn't use this model, now almost all of them are using the same model. But it's worked well for us. And again, we are 100% funded and continue to take a conservative approach because this is a combination of employee money and taxpayer money as well. I'm going to jump off of that and back to myself. The one other item I want to touch, and I saw that this item is also on the agenda, not in the agenda, on the comments, is where we are in election reform. I wish we were further along than we are from a legislative standpoint. I don't know about my colleagues, but I think they would agree. It's not likely we're going to have significant legislation passed and signed prior to the primary. And that's a little troubling because we're looking for answers on pre-canvassing. We're looking for clarification on signatures on mail-in ballots. There are really no definitive rules on drop boxes and a number of other aspects dealing with observers. We're going to make decisions on our side where we're able to act in a way that supports and protects the integrity of the process. But we really need the legislature to move on this. I am involved in a call tomorrow morning with Representative Seth Grove's office on election reform, asking where we are. He is the designated leader in the House on election reform. And two of my commissioner colleagues from other parts of the state, Commissioner Ken Lawrence, who's a Democrat commissioner from Montgomery County, and Commissioner Joe Kantz, a Republican commissioner from Snyder County. Ken is the chair. Joe is the vice chair of the statewide election reform task force. They have been meeting There is at least one member I know from Berks County that's on that task force, or maybe others, a local citizen, and they are also advocating for some serious election reform. And let me clarify something. This has nothing to do with voter suppression. I'm kind of tired of hearing about that. This is about making sure the rules are the same for every single county, and that voters can trust if they vote by mail, their vote's going to count the way they intended it to count. If they vote in person, their vote's going to count as they intended it to count, and that the rules surrounding the election are consistent, enforceable, and support overall election integrity. That is what it's about. Don't add, don't take away, please, from what I'm saying. Again, I know my colleagues agree. That's what we want. We want people to be able to trust in the results of the election. So that's all that I have at this point. And we'll go now to any comments from our row officers. Hearing no comments from our row officers, Mary, if you would, please read the comments from the public.
Thank you. Fred Zencraft, Berkshire Heights. Greetings, commissioners. Inquiring about the state legislature's actions regarding election integrity, the following information was received from Representative Mark Gillen. Rest assured that my colleagues and I are working to avoid a repeat of things that transpired during the 2020 general election. To that end, based upon upholding the Constitution, laws passed by the General Assembly, and the role of the General Assembly in determining the time, place, and manner of elections, the House State Government Committee is in the process of reviewing and continuing the pursuit of an audit of the 2020 election during the 2021-2022 legislative session. State Government Committee Chairman Seth Grove has announced that hearings which can be live streamed addressing these concerns have been or will be held on the following 2021 dates. January 21, Department of State's election guidance. January 28, SURE system, the election management system and other election information technology. February 11, review of election audits, Office of the Auditor General, 2% audits and risk limiting audits. March 4, voter registration. March 10, certification and operation of voting machines with demonstrations. March 18, mail-in and absentee ballots. March 25, contracted vendors. April 1st, county election day operations and satellite offices. April 8th, election integrity policy. April 15, overview of how other states conduct elections. April 22nd, stakeholders and member testimony. May 6th, any further election matters. Representative Gillen encourages us to follow these hearings and provide input to the Pennsylvania State Government Committee members to avoid a future election fraud travesty like that of November 3rd, 2020. I wanted to share what actions our State House legislators are taking to address this issue. Time will tell if their actions are effective. Linda Brancadora, Bern Township. Commissioners, please contact Lehigh Valley Commissioners. They already did a study on the county health care system. This would save our county a lot of money. Studies are expensive. They have decided that a county healthcare system is not conducive to their area. Also, there are only 6 systems statewide that are in effect, so 61 counties are not. I am sure many of the 61 counties have also done studies. I don't think we should spend the money to do something that has already been done numerous times. Get together with these other commissioners and hash it around among yourselves. This would be a much better and more economical way of finding out if our county needs a county healthcare system. I personally don't think so, but I am not privy to the studies that have already been done. Thank you. Christina Worley, Camew Township. Congratulations to our Berks commissioners. Once again, they have proven their strong leadership skills. The CHIRP presentation was clear and informative. This is just another example of their good decision analysis and management. Thank you, commissioners. Becky Ellis, Reading. Good morning, commissioners. I want to thank you for last week's update regarding the lead cleanup and remediation that is ongoing within the Hamburg Borough. Unfortunately, Operable Unit 3, or OU3, as it is often referred to, does not include Kircher Creek Park. The statement made last Thursday was that the area below Kircher Creek Park, including Kircher Creek and Mills Creeks, are part of OU3, which is correct, but Kircher Creek Park is not included within that area, as indicated by the on-scene coordinator of EPA Region 3, Todd Richardson. In a November 10 email, 2020 email to me, in which he had copied John Banks, Mr. Richardson stated, and this is quoted, Kircher Creek Park lies outside the predicted area of lead particulate deposition from the former Price Battery Facility based on air modeling conducted by EPA. Commissioners, as a result of Kircher Creek Park falling outside of the boundaries of OU3, there is no testing or remediation currently being done at Kircher Creek Park. As you and I know, the problem that exists is that ground up battery casings have been found on the Kircher Creek Park property. With that said, since you have not had direct communications with John Banks, I and the community would greatly appreciate your support in advocating for the testing of Kircher Creek Park in its entirety. I had often been told by my neighbors when I lived in Hamburg that battery casings were used as backfill for yards within the Hamburg area and surrounding community. The ground battery casings that I have found that have been found within Kircher Creek Park to date support those statements made by the Hamburg residents. With that being said, being the case, we need to know to what extent that ground battery casings and lead contamination exists within Kircher Creek Park so that the issue can be properly addressed. Thank you. John Archer, Spring Township. Question regarding the county employee pension funding. At a future commissioners meeting, and I believe this morning it has been addressed, can you inform us of the financial status regarding our county's employee funding as to how it is best funded and if its bottom line is in the black or in the red? Crystal Kowalski from Wyomissing. Good morning, commissioners. Last Thursday, it was reported that there was a COVID outbreak at the prison. There were 21 cases among the incarcerated people and 18 cases among the staff. I have a few questions. When did the first positive case of this outbreak occur? How many cases are there currently, and what was the high point of active cases? What weekenders have weekenders been incarcerated during this outbreak? Were the cases from the prison that pushed us back into what pushed us back into the substantial spread category? In response to this outbreak, will you, along with the other stakeholders, commit to keeping the prison population below 575 people? There are discretionary steps that can be taken to achieve this. 1, stop weekender admissions. 2, reduce arrests for petty offenses. 3, only admit people arrested on serious crimes. Don't admit people on new misdemeanor charges, except in cases of domestic violence. 4, the DA's office should refuse to prosecute petty offenses. 5, the DA's office should consent to release most cases on their own recognizance. 6, courts should vacate bench warrants. 7, courts should refuse to jail anyone for unpaid fines or fees. 8, the jails should refuse to admit people on technical probation or parole violations. 9, state legislators should immediately expand the list of non-jailable offenses. 10, county officials should increase early and pretrial releases. It is entirely possible for the BCP to rapidly and significantly reduce its population. Any lesser response would be negligent. Thank you, Crystal Kowalski. Ubelkis Tavares. Hello, my name is Ubelkis Tavares, a citizen of Reading, PA. My question is to Chair Christian Leimbach. Why don't you do the right thing? Why don't you listen to the Berks community? You have the power to terminate the contract with ICE. Your actions show that you are anti-immigrant. You have the choice to work with the community and with Governor Wolf to repurpose that building. Now that immigrant families will no longer be detained in Berks, show leadership and do what's right. Jean Archer, Spring Township. Presuming that Berks County will receive its fair share of new immigrants from the southern border, will newly arriving immigrants be tested and possibly quarantined for communicable diseases such as COVID-19 and tuberculosis? David Del Negro, West Reading. Commissioners, thank you for the update on incoming federal dollars. You all do an amazing job of protecting and considering the taxpayers with all your major decisions. Our founding fathers would be pleased with our local governance. Adrian Jadick, why missing? Just wanted to shortly thank everyone involved in yesterday's draw for ballot positions. I was present in the auditorium and got to enjoy a well-organized operation, thanks to Karen Barsoom and the IT department. Jess Royer, Spring Township. Good morning, Commissioners. The Berks County Community Foundation recently released the report of the Berks County COVID Response Task Force, March 2021. Commissioner Leimbach and Mr. Gottschall were both members of this task force, so you are both likely familiar with the contents of the report. But I want to draw attention to recommendation number 3. Berks County Community Foundation should explore federal and statewide advocacy efforts and join a coalition that is advocating for an increase in funding and resources for the Pennsylvania Department of Health. According to the State Health Access Data Assistance Center, a health policy research program, Pennsylvania has significantly underfunded public health relative to other states, spending just $14.50 per capita versus the national average of $35. In light of this funding, how can we in Berks trust that the state is able to fill our public health needs? I submit that we are exposing ourselves to unnecessary risk and liability by delaying the formation of a county health department, especially given the insufficient nature of the state public health funding. Thank you. Linda Laurie, Byrne Township. Why are we not getting an extension on our property taxes? And that concludes all of the comments from the Q&A.
Thank you very much. We will close the comments at this time. Before I open it up to my colleagues, our County Controller, Sandy Graffius, asked for an opportunity to address an item from her department. Sandy.
I just want everybody to know that got an email from the controller's office. There were 3 staff people that sent out the 1099-G, which is the CARES Act funding money. That is not spam. Please open your emails from the controller's office. It'll be A. France, M. Salvatore, and J. Tizio. That is not spam. Open it up and print it and file it with your 2020 taxes. Thank you, Commissioner.
Thank you very much, Sandy. Would my colleagues like to make any comments?
I just want to follow up on Gene Archer's question. That question came up, or a similar question came up last week in reference. I reached out to a couple of people and have not heard back on that yet as to if anyone is being sent here to Berks County, and if so, how it works. So I followed up with them again to see if they had learned anything, but they did not know of anything last Thursday when I reached out to them. So once I get more information, if I get anything new for next Thursday, I will update that.
The standard operating procedure has always been, though, anyone that came into the facility went through medical immediately, checked, tested. If there's an issue there, they have the ability to put them in a private area to protect others. So the medical, and it's through the Surgeon General, U.S. Surgeon General. So that's always been a key focus. One other related item, we continue to hear, Commissioner Leinbach, commissioners in general, listen to the public, shut the facility down. Unlike the issue of a Department of Health that never came up in the 2019 election, the Berks County Residential Center came up quite often in that election. I talked to a lot of people about it, got a lot of feedback on it, and I think the people did speak based on the results. I was reelected. It was the top vote getter. This idea, and look, I understand passion. It's important to the people to whom it is important, and you have a right to your opinion on that, but don't make the assumption that everyone in Berks County sees things the way that you necessarily see them on this particular issue. I found that not to be the case at all in 2019. That may change at some point in the future, but I'm not hearing that change at this juncture. So right now, what I said last week is where we still are. Nothing has changed. We are waiting to hear from the feds. So that's where we are with the Berks County Residential Center.
Something
yes,
I wanted
Commissioner Rivera.
Yeah, sorry. Something I wanted to clarify was last week the question was around not necessarily people coming. It was not in reference to people coming to the BCRC, but from people coming in that are put on. They read that people that come in were put on buses and sent to different parts of the United States. So the question was, are there people being sent here to Berks County, which I don't know, and that's what I was looking on. Okay. In reference to Jean's question, I'm not sure if she was in reference to that, to people who were just sent here to Berks County and not necessarily to the BCRC, or if she was referring to the people at the BC that were sent to the BCRC. So Commissioner Leinbach, thank you for your clarification that those that are sent to the BCRC are checked out medically and go through that process. Again, if you're referring to the ones that are coming here to the area, but not necessarily to the BCRC, that's where I was saying that I didn't have any information if anyone was coming, and if they were, what the process was.
Anything else?
Motion to adjourn.
Second.
The meeting is adjourned.